Good afternoon, everyone. I hope you're doing well. I tried to get up this morning and put on spring colors for a nice spring day, but instead we have another gloomy day. I hope you're staying dry and warm and, of course, safe and healthy. I appreciate you making time to join us. We have what will probably be a little bit of a shorter update today, so we'll have a little time to take some questions. We've gotten some questions in ahead of time, but we do have some significant updates, and we'll start with those. As usual, we will start with the data and the public health data and what's happening in Ulster County. So we are continuing to see an increase in cases day over day. We're still at about 30 to 40 new COVID positives per day. We now have 1,338 positive cases in the county confirmed. We've tested now over 6,600 residents. And we are now slightly seeing the percentage of positive go down. We're now at 20% instead of 21%. So that's an encouraging sign, both in terms of the number of positives, but also that means we're doing more and more testing, which I think is very important. One of the numbers that we're very, very concerned about and has been difficult the last 48 hours. We've had 11 fatalities in the last 48 hours of Ulster County residents, and that's the worst by far 48-hour stretch that we've had since the beginning of COVID, and we're now at 35 fatalities. We knew that this might be a possibility, that as many people have been battling COVID for weeks, that they may succumb, and unfortunately we're seeing that, and we're of course heartbroken at every loss, and send our love and prayers to the families and the friends of those that we've lost, and we send all of our positive energy we can to those that are continuing to fight COVID in our hospitals and elsewhere around the county. One positive data point to report, we now have 452 recovered cases in Ulster County. So in the last 48 hours, we have seen another 130 added to that number. So we do continue to see that go up at a greater and greater rate, which is at least a positive sign. The other positive sign, if you look at our projection chart in terms of where we're going, you can see where we are today on April 30th, 10 days out. We continue to really lower our projections of worst case, which is good news, and we are still predominantly tracking along and closer to the best case forecast, which would put us at around 1,600 positive cases 10 days out as we get into early May. Again, I am certain, and as is our health commissioner, Dr. Smith, that the reason that we are continuing to see these numbers go down, and the reason that we're along the best case rather than the worst case, is because of you all and what have been a set of difficult but very important and effective policies to keep us home and safe and to slow the spread. So I thank you for that and for continuing to hang in through that. And what we're really focused on now especially is trying to work to lower that fatality number. And ultimately the fatality number is it's really just about a certain percentage of those that are affected. So the less we can, of course, spread, the less folks we're going to have to mourn the loss of as we go forward here. In terms of our hospital and treatment capacity, continued good news here, thanks to our partners at Health Alliance and Ellenville Regional, as well as our regional partners at other hospitals, in New Vance and Dutchess County and others, Orange Regional. We are very comfortable with the treatment capacity that we have. We continue to see, for those of you that have been following, specifically the number of COVID-19 patients in hospital beds is now at 25. So that is very good news. In the last 10 days, really, we have seen the hospitalization numbers really level off and even start to decline over the last few days. We're not quite ready to say that that means anything more than maybe just an aberration, but at a minimum, it's not going up, and that is very, very good news for a whole bunch of reasons. And our ICU beds also are continuing to decrease our usage of ICU beds day over day. So thank you to all of our healthcare partners. I know still every day there are healthcare workers out there risking their lives to treat everyone and keep everyone safe. So thank you to you all for continuing to do that. In terms of testing, despite the fact that we are seeing cases continue to go up, it's mostly, we think, because we're doing more testing. And we need to continue to do more testing. We've only still tested about 3% of our total Ulster County population, and we know we need to do way more testing. So our third testing site has now been open since Monday. I want to thank Health Alliance of the Hudson Valley for opening that site in Midtown Kingston. The numbers at that site of tests have been very good and encouraging in that we've now had over 400 residents tested there. That's both drive up or walk up. And I'll put up the slide here. The only thing you need to do is call this phone number that's on the screen, 845-303-2730. I just want to emphasize, we've had a lot of questions, understandably, about this. If you don't have a doctor, if you don't have your own primary care physician, that is okay. You can call this number and they will take care of you at the site. If you don't have insurance, that is okay. They will take care of you at the site. And all you need to do, again, is call that number. You can see the hours there are Monday through Friday, 9 to 4 for the site. And the phone hours are even longer than that. And as always, if you ever have any questions, not just about the Kingston site, but anything about COVID-19, you can call our Ulster County COVID-19 hotline, which is 845-443-8888. And yes, I've definitely memorized that number at this point. So again, I encourage everyone, the state did, and we did lower the threshold for testing, so more people can be tested now, and we'll publish that information on our site. We talked about that on Tuesday, but particularly seniors over 70, frontline workers, and a set of other folks, and we're going to continue to work to get more and more individuals tested. That's with our diagnostic test. We'll talk a little bit more about the antibody testing coming up here in a moment. One thing that I do want to circle back on that we've talked about now for over a week is what's happening in our senior facilities. Last week, I directed our health department and our whole team to stand up a rapid response team focused on making sure that those in our 13 senior facilities in the county are being kept as safe and healthy as we possibly can. We know how vulnerable our seniors are, and we know how concerned, and I've gotten many calls from family members of those who are in our facilities. So we continue to do widespread testing. We are asking, and in good conversation with New York State about getting more tests to go into the senior facilities. We're hoping to have 2,000 more tests, which will allow us to test the remaining 11 facilities in Ulster County. We're also making sure that they have PPE. Another problem that our facilities are encountering as their staff starts to, some of them get positive results back, we're working to get more staff to help supplement the senior facilities to make sure that they have adequate folks there to care for all the seniors there. So more to come on that, but I do know that there are folks worried about that, and just know that that is really our number one priority right now, is to support our senior facilities and get them what they need. We have had, specifically at Tenbrook Commons, one of the two facilities where we tested all the residents, a significant number of fatalities, unfortunately, and it's absolutely tragic. And just know that we are aware of this. We are doing everything we possibly can, as is the leadership at Tenbrook Commons and our other facilities, to keep everyone safe and healthy. And you can always reach out to us if you're having concerns or problems around all that and anything else. Shifting gears a little bit, I wanted to talk and circle back our economic plan that we talked about on Tuesday, our economic resilience plan. I just want to give some updates on how we're doing with that. As I talked about Tuesday, the real goal is, as we continue to deal with all the public health aspects of this crisis that we talked about just a few, over the last few minutes, we have to begin to think and plan and be ready to get our economy going again. We know that at a certain point, if people aren't able to get back to work and our businesses aren't able to get back open again safely, then the costs and the damage from that will pile up and be very problematic as well. So we're working both of these things in parallel, and we just want to be ready here in Ulster County so that when we are able to get the go-ahead, we can do so responsibly, safely, thoughtfully, and quickly. And that will require everybody working together, government working together, business leaders working together. And since our announcement on Tuesday of our plans, we've had a great response, an overwhelming response of positive feedback of business leaders and community leaders wanting to be part of this planning and this effort. I had a great session yesterday morning with the Ulster County Chamber of Commerce. They did their usual breakfast meeting virtually on Zoom. So that went, I think that was the first time that ever happened, and that went well. And we talked a lot about what our businesses in the county are doing already to pivot their business model. We heard from some of those businesses, and just know that we are here and will continue to be here as a government to work with you, to support you. And really, we know as a county government, we have to move at the speed of business, especially now, and that's really what we're setting up to do. Just as a reminder, in terms of our 3 lines of effort as part of our economic resilience, number 1 is recover. And recovery is comprehensive. It's for families and individuals, and it's also for our businesses. So on the family and individual front, we had our first session of our recovery task force 2 days. I'm losing track of days now. It was either yesterday or the day before. What I think is important for everyone to understand there is we're thinking about this comprehensively. It's not just, of course, our businesses and getting them open and recovered is important, but also we recognize it's about people and individuals and families and making sure that all of their needs for recovery are met, from mental health support to housing and food and other critical essential services that we all need at the most basic level. What's concerning is, in speaking with the leaders of our task force, we are already seeing major spikes in need. We're seeing our numbers of unemployment go way up in the county. We're seeing and hearing concerns about those suffering with addiction. We're seeing demand for housing, and homeless shelters begin to grow. And so those are all signs that we need and have work to do to get ahead of that, and that's really what we're working on there. In addition, in terms of direct business recovery, on our session yesterday with the Chamber, the regional director of our small business, of the federal SBA, Small Business Agency, was on the line and talked about all the programs available to our businesses here in Ulster County. There have been tens of millions of dollars already coming into Ulster County from the federal government in loans to our businesses, and we stand ready here, our Ulster County Economic Development, to help guide you through that, along with SBDC, which is the Small Business Development Center. Our whole team is ready to help you navigate that process of recovery. In terms of reopening, we stood up and announced on Tuesday working groups for each of our core industries in the county. Those have been formed. We have great folks on each of those teams thinking about how can we safely and responsibly reopen as we start to unwind things deliberately, and all that input from our local leaders and our regional leaders will be fielding up to New York State, to Governor Cuomo and his team, and really make sure that we're doing this in a coordinated, synchronized, clear way, so that you all can understand what's happening. But know that that's being informed by leaders here in our community, in our businesses. So I appreciate them taking the time to do that. Lastly, we talked a little bit about realigning. So as we do the immediate recovery and reopening, we also have these opportunities to think about, in an ideal world, how can we even make our economy here stronger, better, more equitable, so that everyone can share in the recovery and the growth as it comes, as we emerge out of COVID-19. One of the things that I talked about on Tuesday was the importance of using all the tools that we have available, particularly as a government. One of those is our IDA, our Industrial Development Agency, and I talked about the need for everybody to work together and to get aligned, particularly with that group. In the 48 hours since we did that, I've received now, I think, over several dozen letters from business owners expressing concern about the current leadership of our IDA. So I've received those. I've heard you. I'm concerned, as you are, that we need every single lever and organization all working together quickly at the speed of business. So thank you to the business leaders that have reached out to myself, and I think also to legislative leadership. We've been discussing that. I think we'll be able to come up with a plan to get that addressed and to get everybody moving forward together, coordinated, and know that that's also a priority for us. So those are the main updates on the public health front and the economic front. We have been getting some questions both ahead of this and a few during, and it's been a little while since we've had time to cover those. So I do want to cover at least a few questions now before we wrap up. If you have questions, you can, as always, include them in the comment section, and we'll try to get to as many as we can. One of the questions that we've been hearing from many folks is around campgrounds. Now that we're getting close or well into the spring, we're seeing more requests and concern and questions about campgrounds and how they're going to operate. So I just wanted to address that. And I know specifically as a Gardner resident, one of the facilities set to open, I think on May 1st, is one of the campgrounds right in Gardner, and we've been getting specific questions about that one, but this applies to many across the county. The way that campgrounds are considered under the New York State guidelines from Governor Cuomo is that they are accommodations. They're just like hotels and other places for accommodation. So they are allowed to stay open under the governor's orders. However, we recognize that there needs to be some more guidance to make sure that they're open safely. So at the county level, we have put out a detailed set of guidance and criteria to each of these campground facilities so that within that framework, they can make sure they're following a whole set, and I'm not going to take everybody's time now because it's a long list of dozens of specific pieces of guidance. We'll put that out again, but the short version is we're doing everything we can to prevent density and to prevent common areas where many people would be interacting. So the idea is that if people are able to come to a campground and really set up what would be effectively their own spot and maintain that distancing with their family or the small group that they came with, then that would be at least the least risky way to operate under the governor's guidance. So we will be putting that guidance out again. We'll be paying very close attention as these different campgrounds come online. Our health department will be monitoring that. If anyone has concerns or sees issues at any of these facilities, that's where you can go and use the pause enforcement task force that we've talked about. You can find that on our ulstercountyny.gov page. There's also a statewide number, which I don't think we have on a slide today, but we will put in the comments section as well. But if you have concerns about that, know that we are aware of that, we're tracking it, and we're really doing our best here at the county level to work within the state's guidance, but make sure that everyone is safe and we're minimizing risk on that. So I know we've gotten some questions on that one. Another area that we've gotten a lot of questions about is testing, and specifically antibody testing. So just as a primer, and thanks to Dr. Smith and our other public health experts for helping me get smart on this, although I'm not the expert. There are really two kinds of tests. Up to this point, we've mostly been talking about diagnostic testing, which means at any given moment in time when you take that test, does your body have the COVID-19 virus at a sufficient level to trigger the test? So all the numbers when we talk about testing have been that diagnostic testing, which we've done now over 6,623 of those tests. What we have not done yet, and we're hoping to do, is the antibody testing. Antibody testing really means rather than testing whether you have the virus at a moment, it means have you had the virus at some point going back in time, and in doing so, your body creates these antibodies, which then is what's really being tested for. So this is a newer form of testing. The state has been doing some really small pilots of this with small sample sets around the state. We don't yet have access to antibody testing here at the county level. I know there's discussion happening with our health department and the state health department to get access. Obviously, that will be a critical tool in addition to diagnostic testing to get us out of the crisis we're in and to give us a better sense and picture of what's happening on the ground. So more to come on that, but many people have been asking, are they available yet? Unfortunately, no, but we are working and pushing. I am pushing to make sure that as they become available, just like we pushed on diagnostic testing, that we'll have antibody testing here as well. One important caveat that I will say up front, when we get antibody testing, the goal and the plan will be to prioritize our frontline workers, our healthcare workers, first responders, those who we'd want to test first to make sure that they can safely go back or continue to be at work. So that'll be where we'll start, and then eventually, hopefully, have enough for as many people as we possibly can. The third area that we've been getting questions about yesterday, which was an encouraging sign, Governor Cuomo announced a set of counties in the state which are eligible now to reactivate hospitals for elective surgeries, meaning many hospitals have been told, or all the hospitals were told, you can only really focus on absolutely essential life-saving surgeries plus COVID treatment and to make sure we had the capacity that we needed. Now that things have started to flatten out a little bit, and based on that data, Ulster County is one of several dozen, I believe, in the state that is now eligible to restart elective surgeries. And I think the most important takeaway for that, there's two big takeaways for all of us. One, it's a positive sign that the state feels that we have enough hospital capacity and the cases are flattened out enough that they think we can reopen this. And secondly, it means that for many people who've been waiting for elective surgeries in the area, you can now get those going. And it means for our hospitals that they can get more of these operations done, which helps them get dollars and money in the door so they can stay open and solvent, which we obviously more than ever know how important that is to keep our hospitals solvent and operating. So that was another question that we got, and there's some clarity there, and you'll be hearing more about that. Those were the big questions that we were hearing quite a bit about. If you have more, please feel free to comment them now or send us a Facebook message. And as we're hearing more of them, we'll address them either on the spot or in our next session. But I wanted to at least hit those because we've been getting a lot of questions on those topics. So as we wrap up for today's session, I do want to give an update. I forgot to give an update on our Project Resilience. Project Resilience, again, as a reminder, this is an effort we started really just a few days after our first cases to deliver food and meals to all of our residents in need, and a community fund, which we've now raised almost $2.5 million into, thanks to you all, to fund that, as well as to keep the doors open at over 160 restaurants in the county who are participating in the program. So we have now delivered 88,000 prepared meals from our local restaurants, delivered at cost. And we've also, as we said on Tuesday, begun to add grocery deliveries in addition, or to supplement, and we've now delivered over 20,000 meals provided by groceries. So all put together, well over 100,000 meals to several thousand households across Ulster County through Project Resilience. I want to thank everyone that has contributed to make that happen, whether a few dollars or more. We still, I just checked before this, every hour we're getting more and more donors. I think we've now had, in terms of grassroots support, close to or over 1,000 individual contributions. So thank you to everyone that's done that. If you get a chance to go on there, even if you don't donate, read some of the comments from people that are donating. It's really powerful and, again, really speaks to the sense of community, the sense of we're all in this together, and that if I'm able to help, even in this tough moment, I'll do whatever I can, to knowing that there's someone out there who has even more need than I do. And I appreciate everyone that's been a part of this program. I can tell you at the end of a long day focused on sometimes some pretty grim numbers and tasks, to then go and check how we're doing on Project Resilience and see that we're delivering meals to folks at this critical moment, that we're providing help with daycare for our frontline workers. That is really cool, and it's thanks to thousands of folks out there that are a part of this as volunteers and participants and donors. So thank you, everyone. We want to keep that going. We plan to keep that going. We're going to deliver meals as long as we have the funds to do so, and that's thanks to everyone that has contributed. And again, as a closing note, as we always do, I just want to thank everyone that's tuned in. It's now been, let's see, it was March 8th, so we're almost at the 2-month mark since our first known case. Everyone that's out there watching or that may watch, thank you for hanging in there and doing your part, whatever that may be. I specifically want to thank all of those on the front lines of COVID, many of whom had no idea that they were signing up to be on the front lines when they, started a job or joined an organization. But our healthcare workers, those in our grocery stores, our transit workers, teachers, pharmacy workers, mail carriers, those still out there making deliveries, especially on a rainy, windy day like today, our journalists, all the frontline workers, thank you. Thank you, thank you. On behalf of 180,000 residents here in Ulster County, we want to thank you for what you're doing. I know that's just, words are only so much, but just know that everyone appreciates it. I definitely appreciate it. And we will end on that positive, optimistic note. I know that if we keep this same spirit, if we keep this same unity and sense of compassion and community, that we will absolutely get through this. I do think we still have more hard days ahead. We still will have more cases. We probably and tragically will lose a few more of our residents, but we're doing everything we can, and everyone has a role to play in trying to slow that and stop that. So thank you. Be healthy, be safe, be resilient, and we will see you next week on Tuesday at 2 p.m.